Okay, good afternoon, everybody. I'll just join, I'll allow people to join as we kind of go through the webinar, but just so we can make a start, because I know you guys are all waiting. Let me just start my video. Amazing. So my name is Victoria. Some of you may have already seen me on a couple of webinars before. I'm part of the Smart Dental compliance team. Today, we're going to be talking about dental monitoring calls, what to expect, what evidence you might need to prepare. And hopefully by the end of the webinar, you'll just feel a lot more confident and a bit of reassurance of how easy it can be to prepare things. So some of you may be our clients already. I know it gets, our webinars get played on YouTube as well. So a lot of people watch them and then they ask us questions. So I'll try and cater for both. So throughout the webinar, I'll show you how you can maybe make your life easier with the system as well. But ultimately, the aim of today is just to get you prepared for a dental monitoring call. Just as I mentioned before, if everyone can stay on mute so everybody can hear me. If for any reason my voice drops so you can't hear me, just drop a message in the chat. If you have any questions, drop a message in the chat anytime, and we'll get back to you towards the end. So let's start. So yes, us at Smart Dental Compliance, obviously we deal with compliance day in, day out. We're here to offer support. We've got a dental compliance software that can make your life really super easy, but we also do a lot of risk assessments, BLS training. So we do a whole host of things. So you might find some of our services useful. So if you do need us, and maybe towards the end of this webinar, you'll think, wow, I need to book this, or how do I do this audit? So do get in contact. Amazing. So dental monitoring calls. So the reason we decided to do a webinar this month on dental monitoring calls was so many people were calling us, panicking almost, and asking us, oh my God, what do I need to prepare? What are they going to ask me? So we thought, let's make a webinar so we can direct our clients and anybody who asks to the webinar, and you can get some tips and a bit of reassurance. So that's what today's webinar is all about. So the dental monitoring call itself, it's part of your overall inspection by the CQC. And really what they're going to be doing is using the call to gather as much information as they can. And using that information, they can assess the priority in coming to your practice and doing an inspection. So the more information that you can essentially give them during the monitoring call or prior, because there's some information you need to send, the less chance there is that they need to come to your practice, because the priority isn't going to be so high. So that's the purpose of it. Also with the changes in the way the inspections are going, it is going to be a lot more online based. So you might need to share your screen, show some evidence, email across some audits if you've said that you've done them. So if you're not digital already with your compliance, definitely start thinking about how you can be. So yes, we have a dental compliance system, and yes, it makes your life super easy, but it doesn't necessarily mean you have to join us and use our system. You might just want to, for now, think about putting things onto drives, or how you can just digitalize stuff, because sometimes you might have like a 24-hour deadline where you need to send them some evidence. So if it's all paper-based and maybe the folders, you don't know where they are, and you've got to find it. So if you can start making things digital now, it's going to really help you for when you do get a call. Amazing. So what to expect during the call. So you'll get an email from the CQC, and within the email, there'll be the date that your call is going to be. There'll be a link for the call. They'll also tell you how long the call is going to take. It's usually about 2 hours. So you need to allocate 2 hours out of your clinic time. Usually the practice manager will do the call. Sometimes the principal and the manager might want to be on it, or your head nurse. And really what you're doing is preparing some dates for them ahead of time. They'll ask you some questions regarding when you last did your audits, your fire risk assessments, etc. Then they're going to ask you a few questions really based on the key lines of inquiry. So for instance, like, are you safe? So are your patients safe? Your recruitment, is that safe? So it's all about the key lines of inquiry and ensuring that you understand them and you're implementing them in your practice. So when they send you the list of documents that you'll need to just basically fill in the dates that you last did them. And there's quite a long list, so bear with me as I start making my way through them. So to start with, they're going to ask you for documents, dates, and data. The first part's all about your staff and your staff training. So they're going to ask you, when did all of your team do infection control, safeguarding, autism and learning disability, medical emergencies, etc. So if you've got a really, really, really big team and you've got all of your CPDs are in HR folders for individual staff, and maybe you've got like a hygienist that works over 2 sites and they keep promising they're going to give you the CPD that they did at the other site. I know what it's like. It can be a bit chaotic. So really what you can start doing is just maybe having a spreadsheet, and on the spreadsheet you could have a list of all of your staff, the CPD that's required and the dates that they've done them, and ensure that your staff are kind of updating them on a regular basis. So with our system, so those of you that use our system, or maybe those of you that don't, we make things super easy. So as you know, we would add all of your staff onto the system. The CPD is on there for them to use. Once they do it, it will automatically go into their HR folders with a date that they last did it and a date that it's next due. But of course, if you've got a team of 40 people, it would be kind of crazy to have to go through each folder and find out, okay, when did they do their infection control? So if you're using our system, really good top tip is just run a report. So if you don't know already, we've got a reporting feature. In the reporting feature, you can go to your HR management reports. In this instance, I want to see the training report. So I'll just quickly run a training report. And what will happen is I'll be able to see all of my staff. As you can see, it's PIN protected. So not all of the team that don't need it can see everybody's data. So bear with me a sec. Amazing. So here we go. So we've got all of our team now on the left-hand side, all of the certificates that they should have, or CPD that they should have, and the dates that they've done it. So now I can quickly identify who hasn't, and you can also then assign some CPD to the people that haven't and get them to do it. So just a top tip for anybody that uses our system, or if you don't and you're looking to use our system or wondered how it works, there is one aspect. So yeah, so that's step one, is getting all of the dates that your team last did their CPD. The next step is all about your audits. So when were your audits last carried out? So some of the audits that they're going to want to look at are your hand hygiene, clinical record keeping, radiography, and so on. So for instance, some of these might be 6 monthly audits. So they would have expected you to have a history of doing them. So they usually want to know about a 2-year period. So you should have kept records of 2 years that you've been doing audits, etc. So you should be doing these every 6 months. Again, it's worth just checking when you last did an audit. Do keep in mind that the purpose of an audit isn't just a tick box exercise. So when you do an audit, you should be identifying any issues, or maybe making action plans of things that you could change, or that's the whole purpose of an audit. So please don't just tick yes, 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 yes. Or if you have ticked no and there's action that was required, ensure that by the time you've next done your audit, the action's been carried out, because that's what the CQC want to see. So it's not, they want to make sure you're doing it every 6 months. They want to make sure that you're identifying issues and that you're actually taking the action that you have said that you're going to. So again, with our system, we've got lots and lots of audit templates. And if you're using our system, you'll know that we've got the activity calendar. With the activity calendar, it's really clever because it pops your audit onto the calendar for you, tells you when you need to do it. So here I've got a cross-infection audit. I can click on my audit, complete it via an e-log here. Once I've completed it, it's going to pop back up in 6 months in my calendar, and that's it, I'm done. And when I'm having my monitoring call and the inspector says, okay, can you share your screen with me? Can I see the evidence of that? You'll be like, no worries, because everything you do on our system, it gets saved in your uploads. So in the uploads, what you can easily do is show them all of the audits that you've done, because it stores it where it needs to. So here we've got practice audits, lovely, automatically saved there. So again, just going digital is amazing, but having a system in place where it automates things, organizes it, is just going to make your life a lot easier, especially with dental monitoring calls. Perfect. Now, the next list or dates that they require are all about service history. So you just need to make sure that your equipment is being serviced, that you have got the reports, keep everything nice and organized, and have a plan or a calendar that's going to prompt you to redo the servicing when it is due. Especially things like your fire alarms, your fixed wire testing, because obviously that's going to determine whether the practice is safe. So they're really, really important. Obviously, you've got like your extra equipment and compressors and autoclave. That it's just really important, especially like oxygen cylinders. You can imagine if you're not having these things serviced and the inspector can see this hasn't been done, then the priority, you on the priority list, you're getting higher and higher up. So just make sure that you're always checking your service history and getting that all done when it's required. So again, with our system, what we've got is you've got the upload, so you can upload all your service history here. You've also got the calendar. So in the calendar, it'll prompt you when you need it. So it's just all about being really organized, really. So when you have the call, if they say to you, okay, can I see the evidence that you had your oxygen serviced, or maybe you're on a contract, you can just quickly go here, show them, because it'll be in your folder. So again, it's just really about kind of gathering all your information, making it nice and organized so you can show the inspector. The next part of the checklist is all about your risk assessments. So risk assessments are your health and safety, your fire, Legionella, etc. Again, making sure that you're booking them, which is amazing, but sometimes there are action required, so things get flagged. So it's really important if you've had a fire risk assessment, and in the fire risk assessment they've noted that maybe you don't have enough fire extinguishers, or you should move some of your fire extinguishers to the front of the building, or there's lots of things that might be in your fire risk assessment. So basically, you're not getting a fire risk assessment just to say you've done it and put it in your folder. There are usually things within the fire risk assessment that you should have actioned or that have been highlighted. So I would advise anybody that's on the webinar or watching it to have a look through the risk assessments that you've either recently had or your last ones, and just see, did we have any action that was required? Sometimes it can be quite a big task. So it can even be like you needed to change the doors, the fire doors. So really do make sure you check them, because that's what the inspector is going to look at.
Sorry, you're missing a BP probe on this train.
Yeah, I'm missing a
but there was a pair of.
Sorry, can everyone just make sure they're muted, please?
Oh, sorry.
Sorry. It's okay.
Thank
you. Amazing. So yeah, so just make sure you're reading your risk assessments. Again, with the system that we have, you're going to be able to find all of your risk assessments within your uploads. Also, with us as a compliance company, we're a little bit different from the other companies on the market, because we've got our own in-house risk assessors, our own in-house BLS trainers. We've got the platinum package where your PAT testing, PVI testing, lots and lots actually, is all included in the package. So what will happen is on your calendar, you'll see that it's due, but our team in the back office, they would have already booked it for you. It would have been carried out and uploaded, so you don't actually even have to worry about it. So you might find maybe, hopefully, after the webinar, you're going to kind of tackle your compliance, see where you're at, maybe look for a checklist. You might find that there's some things that are due. So if you are on one of our packages, it might be a time to upgrade, or if you're not on one of our packages, it might be more cost effective to join and get the platinum and then get things all carried out at once. And just throwing that out there for anybody that might need that support. Then, yeah, so here you go. So you can see the different packages that we have. So with the platinum one, this is the one I was talking about. So you've got your annual risk assessments included. So you've got like fire, Legionella, health and safety. You've got PVI testing for your compressor, your autoclave, in-house BLS. So with our system and going platinum, you don't actually have to worry about anything, because you know it's been done. So when you do have a dental monitoring call, it's really easy, because you're just going to open up your system and you've got that peace of mind that everything's been done. So it's definitely food for thought. So you've sent all that information to the inspector. Obviously, they're going to review it. Then you're going to join the call. So you've got that 2-hour call where you're going to be with the inspector. So during the call, they're going to ask you a range of questions, and they're usually all about the key lines of inquiry, like I mentioned, but they might also ask you to share your screen, so you can provide evidence of the dates that you've sent them. So if you are thinking, oh yeah, let's just put on some bogus dates, they're never going to check that they most definitely are, so don't do that. So they might ask you some questions like, oh, I noticed that your fire risk assessment hasn't been booked this year, can you tell us more information, etc. And then they're going to ask you some questions. So they do send you a really useful link, and it goes to the CQC website, and then it gives you some examples of questions that they might ask. Sometimes they're a little bit vague, because obviously the CQC regulate all types of all types of health sectors. So you've got like for domiciliary GPs, etc. So it's a little bit vague. So I've tried to pull out some and give you examples of the answers that you might need to give to some of the questions they may ask you. Again, if at the end of this call, or if you want to drop in the chat your email address and your practice name, I can send you a checklist of all the documents that you need, so you can use it to put in the dates, and it might help you to kind of see where you're at with your compliance. And then also we do have a template or a resource that gives you some questions and answers. So if you would like a copy of that, do pop the details into the chat and we'll be more than happy to share it. But some of the questions that they may ask are, how do systems, processes and practices keep people safe and safeguarded from abuse? Now, every practice is going to have their own protocol. So I'm not saying copy what the answers I give, and I'm not going to give you really detailed answers, because I would like everybody that's joined the webinar to have a think about what you have in place. But a way to think about answering the question, so if they're talking about safeguarding, obviously you're going to think about the training that your team do. So are they doing their level 1, level 2, level 3 safeguarding? Are you doing background checks, so DBS checks on all of your teams? So that means your team are you're safeguarding your patients from your team. So there's lots of things to think about, and making sure that you've got a safeguarding lead, that you've got your flowchart up, so all the staff know who the safeguarding lead is, what the flowchart is, and then also recording any safeguarding issues. So with our system in the reporting, so if you're using our platform, maybe you don't know that we have this feature, you can report an issue. So you can see that you can report accidents and incidences, you can report a complaint, and you can report a safeguarding issue. So this is really great, because if the safeguarding lead maybe isn't in that day, or they're busy with a patient, or you're unsure kind of what to do, you can actually record the safeguarding issue, and they will be prompted in like real time. So they'll get an alert where we've got the app, they'll have a notification that will come through, or they'll get an email, and then they can take action. So if you're not using this, then I definitely would say to start using it, because what it will do is you'll have a list of all the safeguarding issues. You'll have like a flow of like what the outcome was, what action you took. So definitely use this. But yeah, so one of the questions is going to be regarding safeguarding. So just have a think about what your policy says. Make sure all of your team are aware who the safeguarding lead is, and make sure obviously you know who the local authorities are, or who your partner is in that. Another area that they're going to look at is how effective you are. So an example of a question they might ask is, how does the service make sure that staff have the skills, knowledge and experience to deliver effective care, support and treatment? So obviously have a think about what your practice does, but things that you should be considering is the training opportunities that you're giving your team, so the CPD that might be available, how you're monitoring the CPD that they're carrying out, other things like latest dental techniques, so like other courses maybe for composite or communication or whatever it is that your team need. You might want to conduct regular performance evaluations for your staff. You should be doing your appraisals anyway, so you should be doing them at least once a year. So make sure that you've got appraisals in place. Identifying any issues where training is needed. So by doing performance reviews, or just talking to your staff, you may find that there's training that is required, but you as managers or practice owners, you may want to identify areas where you feel they need training. Again, if it's something like a CPD, like it might be infection control, or maybe you want them to review the safeguarding, you can always assign it to them and get them to do it, and then you can have a performance review with them as well. But these are the type of things that the inspector is going to want to hear that you have in place, so that you're thinking about. We also talk about caring, so another key line of inquiry here. So when we talk about caring, one of the questions that you most likely will be asked is, how does the service support people to express their views and be actively involved in making decisions about their care? So as a dental practice, obviously we need to get consent from our patients. So we want to discuss, when we get this question, we want to talk about treatment plans, giving your patients' options, talking about the cost very clearly, involving the patients in decision making, obtaining consent, and talking about the risk factors. So again, these are all things that you do in your practice day in, day out. Sometimes when you're put under the spotlight by an inspector, your brain freezes and you can't think of the answers, but they are things that you're doing day in, day out. So it's really worthwhile just having a look through some of the questions you might get asked and being prepared. So if you were to get a link for a dental monitoring call, you're prepared and you've thought about what you do as a practice and how you might answer the questions. Another key line of inquiries, one of the areas is responsive. So an example I've pulled up here is, how do you support people to express their views and actively involve them to make decisions as far as possible? So thinking about the question that I've just given you, so you can encourage shared decision making. So patients and yourself work together for their treatment plans and making sure that your goals and values align as well. Giving treatment options really clearly, explaining the pros and the cons, using plain language, visual aids if necessary, thinking about, do you have hearing loops, thinking about if your staff are unsure, remember things CPD such as dealing with patients with autism or learning difficulties can really help to kind of freshen up your communication skills. Seeking feedback from patients. So how do you seek back your feedback? So is that Google reviews? Have you got patient feedback forms in the waiting room? And when you do get that feedback, what do you do with it? So you're having team meetings? Are you discussing the feedback that you've been given, whether it's good or bad? If it's the same person that keeps coming up in complaints or feedback and people aren't happy, are you having those performance reviews to make sure that it doesn't happen again? So again, these are things that you can think about in your own practice, but these are just some kind of examples of what they'll be looking for when they ask you the questions. The next area we're looking at is well-led. So the example I pulled up for you today. So are there clear and effective processes for managing risk, issues, and performance? So with risk, so some of the things that we can do are looking at your audit. So obviously we're going to do risk assessments, audits, so things like infection control are going to be really important. So making sure that you're just doing audits to find any risks before they happen. So, and then again, taking the action that's required to prevent that from happening. Establish clear communication channels for reporting and documenting risks. So again, with our system, you can report the issues on here, but you can also, all your team have the HR on the system where they can make private notes and they can communicate with you directly. So if you're one of the practice managers. So these are just some of the examples of the questions that you will be asked. What will happen is that you'll have the conversation. If they feel that maybe the answers that you're giving them aren't necessarily in alignment with the key lines of inquiry, or perhaps the dates that you've shared, just you're really, really behind, or you might not even have known that you needed to have a risk assessment and thought that you could do that yourself and didn't know it needed to be done by an external company, or if you're not getting patient feedback or you're not carrying out infection control audits, of course, it's going to be a bit of a red flag. And what's going to happen is they're going to have to review that, and the consequences will be maybe they need to come and do a practice visit, or maybe they need to take enforcement. So the more prepared you can be for this call, and the more we can drip feed information to the inspector, and the more we can keep on top of our compliance, the less likely that there is for any issues or kind of enforcements or inspections to be done. So that's a bit about kind of the monitoring call in itself. If anybody would like a demonstration of the system or has any questions, get in contact and we can help you. But like I said, if you want a checklist of things that you can get prepared, or just to help you know about what maybe what's outstanding and that you can start working on, or if you would like a copy of the questions that we have and some example answers, then please do let us know. But thank you. That's been today's webinar. If you have any ideas about webinars that you'd like us to do, please do let us know. You can always contact us, and we're happy to do webinars for things that you guys actually want to hear. Today's one is really just because so many people kept asking us about dental monitoring calls, so we thought let's give you a bit of information. But yeah, if you need any help from us at any time, do let us know. We're always here. If you have any questions, do pop them in the chat. But what we will do is we will get in contact with anybody who has requested the checklist. I can see quite a few of you have, which is amazing. And the webinar will be available on YouTube, so you can watch it back, so we can send you a link. And then if you're thinking of maybe upgrading, or you need extra support, or you want us to do a mock inspection, reach out to us at any time, because that's what we're here for. And yeah, I hope you found it informative, and I will let you get on with your lunch times and have a lovely weekend, because it's Friday. Amazing. Take care, everybody.